there was some joint in the body, and they asked you what are 8 functional things that you would do to fix this. Now, it's not a typical joint and stuff like that, so at most I thought of 4, but I mean, you have 4 like, you know, such a long time that you can think through things, and the big thing is to not get hung up on something that goes wrong. There'll be stations that you don't do great at. That's fine. I mean, chances are you're at least safe and everything like that, and you need to just kind of drop that and go on to the next one, and that's a really hard skill to learn too, which is why if you're practicing here and you're really hard on each other, you will be embarrassed. I was embarrassed when I did a poor job in front of people that I wasn't getting marked on or anything like that, but that embarrassment, you take the information you need from it, you shove it away, and you're on to the next one like nothing ever really bothered you. Everybody has a lab coat. Yeah, because you need a lab coat, which some people didn't know until later on and everything like that. Yeah, anything else you guys can think of?
There are sample questions on the website, but for the explanations, for example, consent is not one of the items that they require.
Yeah.
Will you guys provide us with a list of all the things that we need to?
So, if I'm not mistaken, there is some criteria on the sample questions that they have. If you print out the whole thing, I think on one side they'll have the questions in English and French, and on the back they do have marking criteria. So I did go over those during my study sessions to the point where it almost wasn't worth doing them because I heard the question and I knew I'd done it like 5 times before. I mean, that's a good place to be. There are lots of other like practice questions that might be circulating around there and stuff like that. I know that my friends got a hold of some, and the important thing is that it's just a new scenario that you didn't have to think of, that somebody's presented to you. But it's good to just, practice. Do the ones you're really not comfortable with. Do the ones you are comfortable with so that you get them done. Harpreet had mentioned last time that if you think about it, a hard question is hard. Not everybody's going to do well on it. An easy question, everybody's going to do well on it. So you need to do well on your easy questions because everybody else is doing well on their easy questions. So even if it's something that you think you have a good grasp on, you need to be a rock star at it.
Questions? There are a few people in Edmonton. Guys, can you hear us? Maybe just want to hold you the video. So,
I have one more question.
yeah, go ahead.
How many stations do we
Speak loud.
need? How many stations do we need to pass?
So, we don't even need to think about the question. Our goal is to pass all 16 stations.
All 16.
That's it. So we don't, like, our goal is not to pass 10 stations or 8 stations or minimum passing. Our goal is to pass all 16 stations. So first of all, sorry, I was trying to connect with the Edmonton group. So welcome. This course is, for me, for all of us, it's very, very important. This is something we are very passionate about, and we love doing this. We love teaching. So I understand your expectations, right? So, but we as a team also have expectations from you and from the Edmonton batch. So our expectation is that once we give you some work to do at home, for example, our next class will be ortho. We'll discuss the schedule. I am expecting everybody to be very thorough with the theory, right, of ortho. Everybody has practiced few stations when you're practicing, right? Everybody knows the simple tests. At least they know the theory-wise, right? So, if, for example, if you're doing an ankle, you know what anterior draw test is and basics, how to do it. Right? So that's very, very important, and that's what I expect you to guys to come, so that we can actually discuss in detail what's the safety issues, what's the problem, and we can practice a lot of questions. The more questions we practice, the more concept-based questions we practice, the more easier it's going to be. So there are thousands of questions floating around. if you practice those 1,000 questions and there's another 1,001 question in the exam, you'll get confused. But if your practice is concept-based, an example, how to do a proper assessment of ankle, right? How to do a proper a test. There could be any question, and then you won't have problems. Right? So in my experience, there are two main issues that's preventing people from passing this exam. First, for students whose English is not the first language, is your communication. The tests these days are changed. So I think 5 years back, or in my days, the Canadian grads used to be like 95% pass, 98% pass, right? International students very less. So the Canadian grad pass rate has gone down a lot. Reason is because now the exam is still skill-based exam. They will test you on the skill, but now they're adding more, they're integrating systems, and they're adding more ethics. They're adding more patient education, right? They're adding more explanation. For example, low back pain, teach 2 exercises, 2 marks, explain the importance of these exercises, 8 marks, right? So, patient was put on IFC, your assistant put on IFC, the patient got burned. Now what you do? So these kind of questions, patient had stroke, give them, or just tell them the value of exercises or diet or something. So these kind of communication things that they've added a lot. So that is something that, communication that we suffer. And physios who are practicing have also a high chance of failing, because especially Canadian grads, as they enter the clinic, right, and they're practicing, and so they go in the exam and they do the exact same as they do it in the clinic. As Thomas said, this is one of the biggest mistakes. Right? You just cannot attempt the exam as you see your patients. It's a drama. The exam, in a sense, drama is that you have to perform. Right? So you have to enter the station. Never in a clinic you will enter a station and it will say, "Good morning, my name is Harpreet Singh and I'm a physiotherapy intern," and blah blah blah. Right? So you'll never do this. I'll speak to Trina. How are we doing? Yeah.
Sorry,
No.
just trapped.
Yeah. You want to just grab a seat, chair? Can you just introduce yourself a little bit?
Yeah, sorry, I'm Katrina. Studied in Ireland, passed the written in April, working now, aiming for November.
So what I was saying that, so students who are working as physios have this concept that going in the exam, they're going to do exactly the same thing as do with the patients. That's not the case. It is very different. So when you're attempting a station, introduction, proper consent, you always have to assume that the examiner is blind. You will only get marks for things that you speak. So even if you do the whole station correctly and you've not spoken, you won't get marks. Any questions about this? Do you know how important this concept is? If you understand this concept, you already pass the exam like 50%. So if you are not speaking what you're doing, you're not going to pass the exam.
And that is probably the biggest thing that I learned here and got better at, is not just doing it, but talking through it. And at first you just feel like you're jabbering on and everything like that. But again, the more you do it, the more natural it becomes. But yeah, and I mean, the way that I kind of got around it, yeah, think that your examiner is blind, because they might be. They might just be looking at their piece of paper, waiting for you to tell them something that they can give you a mark for. Not only that, but I almost kind of took it that kind of does tie in with patient consent, patient information. If I'm telling them what I'm doing, that's my job, telling them where things are going. I'm keeping them informed. So it got a bit better for me to think of it that way. It didn't feel like I was going extraordinarily out of my way just for the examiner, but this is also for the patient too. I mean, when you're at a doctor's office, you want to know what's going on and everything like that. You don't want to just sit there and have them do stuff. So it's not a bad habit to get into.
I'll tell you my example. So I think a few years back, I was taking an OSCE exam at the University of Alberta at Calgary campus. So I think that was my first or second as an examiner, and we had 16 students, and the first hour, you know, this is my first exam, I'm very motivated, I was on, you know, I was like, so I was watching. The exam went for like 5-6 hours. After 2 or 3, I just got mentally tired. Because they called us early at 7 o'clock, exam started at 9, orientation, and we have to arrange our stations, and you know, we have to make sure everything. So by 10 or 11, I was tired. So by the last 6 students, or what, I was, you know, because I had 10 students repeat the same, so I knew what was going on. So I was sitting here. I was so tired, and they were performing. And so you have a big sheet where you have to check mark, right? So you have to check mark, so there are points. So you have to check, this is correct, this is correct. So the answers are given. In the end, you have to pass, fail a student. So if you're failing a student, you have to write explanation. You have to write, why did you fail the station? If you pass, if you write a lot of comments, just imagine you have 10 minutes, and you have to watch the student, and they have just 1 minute to read. So in the last 1 minute, I have to write everything. So things are so rushed that I could have missed a lot of people's things. So actually, I'm writing and I'm listening to what they're saying. So my focus is not on actually what they're doing. Maybe there's some better examiners than me. I'm just telling you about my example. So I was writing, and then there were some students who did safety, and I had to write in detail, because the examiners there don't decide if you pass and fail. The sheets are collected, they go to the head office, and then they read and then decide if you have passed or failed. So, but you have to write as much as you can on those sheets. So I am just listening, right? And I'm listening and I'm just writing. So even if you have done everything correctly, if you have not spoken what you have said, it's not going to work for you. So even if you're changing sides, if you're changing directions, if you're putting your hands or putting stuff, you know, you just need to talk.
And Harpreet touched on it earlier, but communication is big points there. I'm very fortunate. This is kind of my regular talking voice. It's loud. It carries. After my exam, a girl came up to me and said, "Hey, you were the guy who was in the station behind me." I said, "How'd you know?" She said, "I could hear you at every time you were talking." I guarantee you no examiner had any problem hearing what I was saying. I was loud. If you're loud, you sound confident. If you sound confident, the examiner presumes you're confident. They think you're confident because you know what you're doing. They're probably biased that way too, just from how you sound. So you can't whisper. It's got to be loud.
Yeah. So you just have to practice a lot.
Sorry, who do you talk to? You talk to the patient, right?
It depends. So we'll go with that. So it depends. It depends on the question. Most of it's talking to the patient, but there are questions where explain your findings to the examiner. So we'll touch that when we go through this presentation. Any other questions? Any other thing what we do in the exam or how the exam is? Has anybody of you attempted the exam before? So, was there any problems that you had?
I had no clue. Basically, had no clue. So my mistake basically was I was doing the things that I was doing in the clinic. Like I was working at the time, but I treated the patient as I would treat a patient in my practice, and I really didn't know what they expect us to do. I didn't know about the checklist. I missed many points. I know that there wasn't anything that I didn't really know, but I really didn't know how to do it, and I didn't know that I need to verbalize it.
So So what was your issues that you were having in the exam?
I think it was largely confidence,
Mhm.
a set of nerves that was difficult to deal with, and not having the insight that I have some more knowledge about now. But I mean, even something as simple as asking and gaining consent in the correct, the systematic way that you need to do it. So
Mhm.
I certainly lost points on that.
Mhm. And what about you, Ray?
In my case, when I'm practicing before exam,
Yeah.
I'm okay. I remember exactly the points, right? What to do, asking consent, and then proceed. What was the question? But when I go inside the real exam, I feel scared and I'm so nervous. So I forget lots of important points. So that's why I don't get marks for that. I think that's the question because after my exam, I also asked the feedback.
Mhm.
So I got that I missed lots of points.
I'll give you an example. We had a student in the last batch, so doing really well, and he was confident. So he went in the exam. He told me what happens. He went in the exam that day, and he just met another person from Edmonton, and that student approached him and said, "Hey, let's just revise things." So he started revising, and that Edmonton student was talking something that he had never done or never heard. His confidence from 100 went to 0. When he went in, he just could not perform in the exam. So just remember, even if you've worked very hard, that day of that exam is very important. Do not talk to anybody, right? Just focus on yourself, keep your calm. No need to discuss after or before the exam, right? First thing is these questions, the privacy of these questions is a lifelong responsibility, right? So we need to make sure that the actual questions that are in exam, we don't share with them. That's a legal thing, right? But even for mental, like you don't want to discuss issues or discuss questions or even revise. So he was doing really well. He practiced so hard, but he said, like, "Sir, I just could not perform because of that 5-minute talk that I had with this guy." And I thought that I have not done anything. His confidence would. So having good confidence, tell yourself, "I'm going to do well. I'm going to do well." And then go in the station will actually help you a lot. Any other questions?
I might just add to what you
Yeah.
said there, but if you don't know it half hour before the exam, there's no point in learning it. All your preparation should be done before. My exam was in Ottawa. I didn't know anybody in Ottawa. Thought I could sleep in. Too nervous, couldn't do it, so I was up really early, going through my notes. I don't even know if I was reading anything. I was just flipping pages, and couldn't take it anymore. Went to the exam, got in there, and it was like a graveyard in there. Everybody's in there and nobody's doing it. Now me, I'm a bit of a social person, so started talking with people, getting laughs and everything like that, but nothing about physio. Nothing about physio. And I think that's important that you learn that is you're only going to confuse yourself, and you don't know if the person who's saying something, you don't know if they're right. So there's no point in trying to confuse yourself or anything like that. Trust that you've put in the work before. Trust that you know what you're doing. Trust that even if you come across something that you don't know, that you have the skills to figure it out on the spot. There will be questions that you cannot prepare for. It'll be, watch this person do this, comment 4 things on it, and 2 exercises. I don't care how much prep you've done. You don't know what you're going to do until you've seen them walk and seen them present. So on the day of, it's all about trying not to be stressed. Don't revise things, just try not to be stressed. Yeah.
Another important thing that you mentioned is that, like, I started with the 5-minute stations, and it's so rushed and frustrating. Like I caught myself frustrated after some stations, and I really couldn't hide my frustration when I entered the room. So that's something that I think I missed many stations because of that.
I was very polar opposite when I was going in. If I had a very comfortable question, I was done my 5-minute station in 3 minutes. And I was sitting there quietly for the last 2 minutes, but I know that I did everything right. Questions I wasn't comfortable with, last second of the buzzer, I was still going off things. I'm sure I was sweating profusely and everything like that. I was so nervous. It'll happen. It'll happen. Yeah.
One of the things I want to learn here is how to handle that situation, because especially in the 10-minute stations, I was sitting there like 3-4 minutes, which last, I don't know, 30 minutes for me.
Yeah.
Like awkward silence, and I really didn't know how to fill that gap.
So that comes down to practice.
Practice.
How you practice. So when I was practicing, every time I had a timer. Every time. And if you have 2 people, you kind of have to just see what your time was afterwards. If you have a third person, which I highly recommend, one person's a patient, one person's a physio, one person's the examiner. The examiner is giving that 1-minute warning, and you have to practice it like it's going to be in the exam. So you have a timer. You have to get the proper feedback. Like I said, if you do it and it's good, I guarantee you, right now, if you took somebody at the ortho division for Canada and they did this exam, they would not go through 100%. I don't think there's any, even stations I knew that I had absolutely rocked. There's stuff I know I did wrong. I don't think anybody goes through without some kind of feedback, something they can improve upon. And it's on you to help yourself and help other people with that. That's one of the great things about this, is you get to know this group, you get to practice together, and you have to trust each other, and you have to be willing to call people out on what they don't know and help them with it. And they'll do the same for you. And you do that, that's how you're going to get better, is by finding what those weak spots are. And a lot of times you won't know. Somebody has to identify that for you. So get out of your comfort zone, do it in that time, learn your speech, what you're going to say. I had my consent speech memorized. I had my exit speech memorized. If I had to give somebody an exercise, I pretty much had that memorized of what I was going to do, just input this for this, and that was it. Everything was rehearsed. I didn't want to leave really anything to chance, and there was still stuff that I had to make up on the spot while I was there, but I just tried to keep that at extreme minimum, and I had everything so that it came out naturally, as best I can, even as nervous as I was.
And I think this course, or any, like the PCE courses that are run, are different from other courses, right? So other courses, you're learning a new skill and then you can perform and everything's happy. This course, the only value for you and for us in this course is only if you pass. If you do not pass, you have lost, like we have lost the value, and this course is not going to be of any value to you. So this course, we need you, everybody, to pass. So I'm going to make a promise to you, and I'm going to tell you what my expectations are going to be. If we fall short, in the sense, is if there's a class that you didn't like, or the instructor that you didn't like, or is something that you didn't understand, tell us. We will repeat that class. But if you do not match our expectations, right? If you're come to our ortho class or neuro class, and then you don't know the basic theory, or you don't know even how to enter a station, we will call you out in front of everybody. So we will tell you that you are not making that effort that we require. Right? So that is something that I just want you to be very clear of. Some students have felt offended, but I think this is the most important part, and this because I'm very passionate about this. This is the most important course you'll ever do, and especially somebody who has done second or third or their last attempt. First attempt is the best attempt to pass. Nothing like than first attempt. Second attempt, there's stress, because if you don't pass, you won't work. Third attempt, oh my God, that's it, right? So your first attempt is the best attempt. And then if English is your first language, or even if you're a Canadian grad, don't get overconfident, right? So we have so many Canadian grads that now are struggling, and this is their third attempt, right? So just make sure, very, very important is your group. So choose 3 people. You should have 3 people, not less than 3, not more than 3 in your group. Choose those people who are serious. If they are not serious, if they have not studied, chuck them out, because your life depends on this. Your life will depend on that 3 people, because you're going to practice for these past 3 months with those 3 people. Be loyal to them, be friendly, have that thing that we all 3 should pass. But choose those 3 people very carefully. The biggest mistake that people do is they prepare for the theory, right? And then they prepare for the practical the same way they do for your theory. You cannot prepare for your practical the way you prepared for the theory. You are dependent on the group to pass. It's about performance. So you're dependent on those other 2 people to pass. Be flexible with the time. Practice at least 7 to 8 hours in a stretch. That will increase your stamina, right? So your group is very, very important. So you can choose people from this group, or Edmonton people can choose from their group, and just start practicing, right? That's very important. How do you have practice?
So, in terms related to this course, you should be coming prepared for what we're gonna do. It's not really necessarily we're teaching you something. We're revising it quickly, showing you how it should be done in that performance kind of way. So don't use Sunday to learn. Use Sunday to revise.
Revise. Perfect. That's perfect.
One of the hardest parts is not getting lazy when you're studying, and when you're practicing. When you've done 10 scenarios in a row, you really feel like just saying, okay, let's just skip the consent, let's skip this, let's just get to that. No. It needs to be so automatic that you're not skipping anything that you have to do. Every time you're practicing, you're performing like you would in the exam. You can take little times to, practice certain parts that you don't know in little pieces, but I would take every scenario, top to bottom, just like you would in the exam. Start with your consent, go through what the question asks you, nothing more, just what the question asks you, and then close off. It has to be like the exam. You're going to get lazy, you're going to only want to do parts of it, you're going to want to skip the consent. I really urge you, don't do it. Really don't do it. Keep it as strict, as formal. I know you sometimes you'll be practicing with friends and you have laughs and stuff like that, but sadly this isn't really a laughing matter. It's a lot of money to take this exam. If you fail it, things get complicated fast. I wanted to pass that exam very badly, and I was willing to sacrifice months of my time to do it. And I was stressful for months, but it's finished now. So
a lot of students will ask me questions. You're taking classes on long weekends and stuff. So from this day till November, your exam, there's no long weekend for you, right? So just understand, your long weekends and everything are done. There's no holiday, no vacation, no long weekends until you do your exam. Once you come out of your exam, that's it. And then you can have fun. Yeah, go ahead.
I would like to know, what do we need to have in order to prepare for the practical exam, like let's say lab coat, goniometer, or knee hammer and stuff like that we need to carry with us in the exam. Also, the other thing is you have stressed more important about taking consent from the patient. As far as I know, we take consent in the beginning, that do I have your consent, or may I proceed further if you're okay with it, right?
So we do go over more of what exactly entails consent, because consent isn't just, I'm here to do an assessment, do I have your consent? This patient is a blank slate. You have to assume they know nothing. That this is their first time at physio, they have no idea about any part of the human body or anything like that. So we'll go into it more, but it's, if it's an assessment, I'd say, hi, my name is Thomas Lathrop. I'm a physiotherapy resident. I'm here to do an assessment for you because I've heard that you have an ankle sprain. So what we're going to do is I'm going to take you through some range of motion exercises, some resisted strength exercises, do a couple special tests, and if we have any questions along the way or you want to stop at any time, let me know. Some of these things might cause your pain. If it does, let me know. We can stop. Do I have your consent to continue? Yes. Now, in real life, even if you were trying to say that, you'd probably never say to somebody, do I have your consent? You'd say, is that okay with you? But I wanted to leave no doubt in the examiner's mind that I had said that word. There are buzzwords that you should say. Consent is one of those buzzwords. Do I have your consent? Not, is this okay with you? Do I have your consent? We're going to go through range of motion, not just I'm going to move your arm. I want the examiner to know that I'm doing passive range of motion. I explain what it is to the patient. active range of motion. I explain what it is to the patient. So I'm talking to the patient, but I'm also talking to the examiner as well. And I just left absolutely nothing for debate in the examiner's mind. Oh, did they do this? Oh, they kind of look like they did, but I don't remember them saying it or anything like that. I use as many buzzwords as I could think of that I thought they're going to have on their marking sheet. They're going to want to know, even if it was something like isometric exercise. Is it imperative that a patient knows exactly what an isometric exercise is? Probably not. More important that they can just do the exercise. But on the exam, I let them know that that's doing that muscle contraction without going through a range of motion. There's no doubt in the examiner's mind. They know that I know what I'm talking about, that I'm informing the patient. No question for debate. I've got those points.
Did you use those terms, range of motion, muscle contraction?
I did, but I was very, very good about explaining what that was in layman's term right after. So if I said that I was going to do passive range of motion, that meant that I was going to take their arm through the movement. If I was going to get them to do active range of motion, they were going to do the movement for them. Isometric, yeah, not going through a range. If I was going to get them to do eccentric exercise, I explained that that's just the lengthening portion of that muscle activating. I kind of blended it in with the very technical, but also the layman's terms as well. You got to be careful with that because you can get caught up just doing a lot of talking when you should be doing stuff. But like I said, I practiced it, so it came out naturally. I did it at the clinic all the time when I was working. I'd explain to somebody what this was, but I knew that they wouldn't know that, so I'd explain what it is in layman's terms, and you get natural with it. Yeah.
So if you explain that technical terms, is still acceptable to use those terms?
I think so. If you've said, like, we're going to do an isometric thing, this is what an isometric is, from that point on, you assume that they, unless they've asked you a question about it, you assume that they've understood what you're talking about and you keep going. Also in my consent, like I said, I would say if you have any questions about anything, ask me. And therefore, I let the examiner know and the patient know that's my out. Like if they have something that they didn't feel was comfortable or something like that, they could ask me a question because I've given them that direction. Maybe they're not told to voice any opinion unless they've been told that. There's questions that you'll get in the exam, and it's asking you to respond to a patient's question. And I found that I had to go and I had to prompt them for that question, even though that was what their act was to ask 3 questions about it. I still had to go and I had to prompt them for that. And I knew that once I got those questions out, I had to go further and prompt them more. They're going to give you enough, and I guarantee you most of the people there want you to pass. They want to be able to say these things to you, and they're probably dying inside. Can you please mention this so that I can tell you about this, and I'll get you to the next part. So you have to give them the chance to help you. Yeah.
Please don't think, when I entered this, I thought Alliance, PT, or they don't want us to pass, or they don't want international students to pass. That's not the case. They want you to pass. They have made this very simple, but they're just sometimes waiting for you to say the correct thing so that they can check mark, right? So you are going to treat the Canadian public. They just want to make sure that you guys are safe, that you can safely treat our citizens, and there will not be any issues. That's the only thing. That's the standard, right? So everybody wants you to pass, but they're just making sure that you have done the proper effort and you have studied well, right? So I think it all comes to practice. Just remember, you are competing against those people who have practiced 8 hours, 10 hours. You know why those graph goes up. So, it's so that you pass. So they make a graph and you pass and fail. So when you are a Canadian, when you were studying, how often did you do this OSCE?
We had a class where we kind of focused on it a little bit, but it was more of the multi-systems one. And then, they kind of sprinkle it in throughout the course, but U of S hasn't been doing great on the exam, so they've kind of been focusing on doing more practice scenarios like this. Yeah. And trying to work that more into the caseload. Yeah.
So you've been doing a lot of OSCE stations and stuff?
We had a couple days where we did a couple practice exams, but I wouldn't say all the time. Maybe, and then we try to mimic our OSCE situations with our MSK or our cardio resp exams throughout the course. We're in the same area where we would, right, where you were in Saskatoon or where you would do your clinical exam. And they try to do their best.
So people from Ireland, Scotland. So were you exposed to OSCEs?
Yeah.
100%. All of our exams
Exams are like that.
by the type
Yeah.
situation. We
Yeah.
had no written exams. It was all verbal.
Oh, well. Okay. What about you guys?
No, asking no.
Okay. Yeah, go ahead.
I'm sorry. So you're saying that we won't be at the end of the day won't be evaluated based on our own performance, but we would be compared to other people.
No, you will be evaluated on your performance, but again, what categorizes as pass and fail depends on that curve. So, for example, if you have a very simple station, two things I really want to mention that. So, 5-minute station, 10-minute station. So, if you have a really simple station, for example, all stations are simple, but 90% of the students who are giving the OSCE that day have passed that station, and you have not. So your location in the graph is going to come down a lot. So if you do not do well on a simple station, then your chances of passing is very, very low. Even if you do well on a complex station. For example, there's a station which you don't know, and you ace that station, and 90% of the students fail. Most probably, I think what happens is that they won't even count the station. They just throw the station out. It's those simple stations that matter a lot. And it's those theory questions that matter the most in the 5-minute station. So you got your review, right? So did you read about that theory? Did they tell you the importance and what was more important in 5-minute stations? Was it theory or practical? Or the practical?
Both. It's 50-50%.
Yeah. But so if you go in the Alliance website, right? So which we're going to go through. So I think they've mentioned it. Even if you do not do well in the practical part of the 5 station, if you do well in the theory part, you will pass.
And the opposite.
Yeah,
You do
and
really well in the practical and you don't know any of the written.
Your faith.
You will fail. So that theory part, those written stations are very, very important. So that's why it's very important to give your theory and practical besides. It's easier for those students, right? So don't forget your theory.
So do we already know what type of questions would be categorized as simple and which ones are like complicated stations?
You know, you'll know. For example, do a shoulder assessment. That's as simple as that. Do 2 tests for ankle.
Yeah.
Very simple. Just direct, straight. A patient was in a stroke and they had this. Do something complicated? That's a complicated question, which is which a lot of students will not do well. So I was going through one of the reviews. So they tell you by each station, where do you fall in the graph? Do you fall in the 60% category, 70%? And that is how much everybody else has done it well. So they have these 10. So when you get your review card, you have these stations, 10-minute stations and 5-minute stations, and that's your score. Your score is based on everybody else. Right? So if you're 90% means that you're in that, everybody did well on that, and you didn't well. So people who I had last time, I had a student who passed 12 stations, and did not pass the exams. That's crazy, and because the global score was so low that she didn't allow to pass. So you have to pass the minimum number of stations. Second, you have to meet a minimum global score. Third, there should be no major safety mistake. These are 3 criteria for you to successfully pass the exam. Even if you pass 12 stations, pardon?
Can you repeat them?
Yeah, so minimum stations, I think they're 9 or 10, right? You have to have a minimum standard of global score that you have to meet, and then you don't have to do any major safety. 2 minor safety is allowed, but 1 major safety is failed. So if you meet all these 3, you pass. If you're not meeting any one of these, doesn't matter if you pass 16 stations, you will not pass the exam. Right. So Thomas, I'm just want you to read those and just tell your viewpoint, and then we'll discuss this.
Sure.
So this is from the Alliance website, right? I think that's a lot of people miss going there. That's very valuable. There are a lot of resources on it. So this is what we call the most common errors of candidate attempting the clinical exam. And this will answer a lot of your questions. This is how we're going to focus our practice, our scenarios here, right? Okay.
So number one, doing something that is not part of the instructions. This deservedly so is at number one on the list there. This is only 5 minutes or 10 minutes. That isn't a lot of time, and a lot of times they know that. So they probably won't give you do a whole shoulder assessment even in 10 minutes, because once you get into that, you have to be cooking and be on your game to even get that done in 10 minutes. They might say they only want you to look at active range of the right side. Now, you still know in your mind, well, I should always do the unaffected side first, and maybe I should do that because that'd be safety if I did. Verbalizing comes in there. I would do the other side, and you can even, remember, it's drama, right? So if this happened to me, I would say, we're gonna do this on your active range on your right side. I know I've already checked your left, and your left is fine. I didn't actually check it, but the question said don't do it. I assumed that rule. They give you only specific part of that assessment for a reason. It's because A, time, B, that's all the examiner's looking for. They're not looking for bonus points. They're looking for exactly what they have written there. If you do great, you do this wonderful assessment, but you haven't done those two points, you'd fail. If you only do those 2 points and know the rest of the assessment, you pass. So you have to really read the question correctly, focus on what it is specifically they're asking you to do, and that's what you need to do.
So are you doing an assessment in a treatment or a treatment in an assessment? For example, a station is take a focused functional history of a patient who's working in an office. So all you have to do is focus on the functional history. That's it. Nothing else. Chief complaint or previous history, surgical history. No, functional history. Do an objective assessment on an ankle. Right? So if I start my station, like, introduction, what was the injury? When did this happen? How is your pain? That is not being asked. Even if you ask, so for example, the limitation is the examiner has a checklist, and those questions that you're asking are not in the checklist. So he just can't tick mark, and you're wasting your time. So the question is focus assessment. So means you have to have your assessment. You don't need to ask questions. Definitely in a consent, you need to ask, how is your pain? How are you doing well? And then move on to your assessment. Right? So don't assess when there's history, and don't take history when there's just assessment. Just make sure you focus, read the question very carefully, and there's no trick. There is no trick in the question. Right? So if they ask you to do that, just do what's written in the question. Right? Any questions?
So let's say my friend is a patient right now, and he had like a shoulder injury or an elbow injury about 4 weeks ago. Now he's with me, and that's the scenario, that a 4-week post tennis elbow, and give him home exercise program.
Mm-hmm.
So after I introduce myself, after I speak about the consent, and the next part, do I ask him anything about the subjective, or do I check anything objective, or straight jump to the exercise and home exercise program?
I would play it up as the performance again, and I'd say on our last time in, we did the objective. We know that you have that. I'm going to take you through a couple exercises that are going to help you start to feel better. Right into it there.
Because the stations are designed so that you can comfortably complete the stations if you're doing what they're said, right? So the question is 4 weeks of post fracture, for example. Teach them 2 exercises. So you had a question?
No.
Oh, I thought you raised your hand. So you take the consent. Part of the consent is to ask how you're doing, how your pain level is, if you're comfortable, and then ask the question, have you done any exercises before? Right? So these are the things that we're going to go through, but you jump into those exercises. You don't do any assessment. You don't ask about any other question. That's a waste of time, because those 2 exercises will take you at least 5 minutes if it's a 5-minute station. If it's a 10-minute station, there will be 3 or 4 exercises. You could hardly complete those 4 in those stations. If you go and ask something else, you're not going to get marks, and then you're going to run out of time. So if they've asked you 2 exercises, do 2 exercises.
It comes down to, again, of in practice, in real life, absolutely. You check in with them, you get their subjective, you would reassess, then you get into anything. They don't have any points for that. They don't have any points for that. They don't care about that. They want to know just about that. So it's hard at the beginning, I think you'll find, and I guarantee you the first couple sessions that we have here, there's going to be a lot of questions about being, why would you do that? Why wouldn't you do this? And the answer always comes down to, on the exam, they don't care. It doesn't help you on the exam. Real life, absolutely. Absolutely. This exam, I personally don't really think it's about making you a better physio. It's about making you a better physio performer. And you just have to learn to play that role. You have to perform. And when you ask the questions, we know that in real life you have to do more. We know you have to reassess before you're going to go in there, and you're going to get a lot more detailed stuff. But that's not what the purpose of this exam is. Yeah.
Any other questions? Okay. The second, this is very important.
So talking to the examiner instead of the standardized client. So Harpreet touched on this earlier, where sometimes they say you are going to be talking to the examiner. Otherwise, it's assumed the examiner actually isn't in the room. So everything has to be understood at a layman's term for the patient. I still talk like I know the examiner's there. Like, I'm going to say things that might not be super important to the patient, but important for me to vocalize that I'm doing something. But if they find that you're looking at them and talking to them, that's like you being with the patient and looking into the corner and stuff like that. That's just not good communication. That's not what they're looking for in the question. So it has to be to the patient only, unless specifically asked, in which case, again, I probably played it up too much like I was an actor or something like that. But anytime that it was asking me to talk to the examiner, I would tell the patient that my supervisor is here and I'm just going to explain my findings to the supervisor. So it wasn't like I'm just talking to an examiner. It was still in the role. I was still always playing that same part. I'd say, I'm going to just watch I'm going to watch you walk. I'm going to just be commenting on a couple things that I see to my supervisor here. If you have any questions about what I'm saying, if it doesn't make sense, let me know. There we go. I'm talking to the examiner. I can use special terms because I'm talking to the examiner, but I've also let both of them know if they want me to clarify something they don't understand, there's that opportunity for them to do that as well. Yeah.
So a lot of students fail some of these stations is, so do a range of motion assessment on the patient, explain your findings to the examiner. So again, you're talking to the patient, but again, in this moment, if you do not verbalize or explain the findings to the examiner, you will not get marks. So just please read the questions very carefully. Does it say explain the findings to the examiner? If it says explain the findings to the examiner, right, as Thomas said, you need to talk to the examiner directly. This is what I've done, this is what I've observed, and this is my findings. Again, another question is, how specific do we need to about ranges? So knee flexion, 120 degrees normal, right? So it doesn't matter, range does not matter here. If you say 110, if you say 100, if you say, close by, it doesn't matter. Where you put your goniometer, how you do it, that's important. Unless you don't say something crazy, 180 or 360, that number does not matter. Ankle dorsiflexion, how much degrees? You don't say 360, doesn't matter. So that number, do not focus on that number. Focus on, so that's the difference in theory and practical. Theory, you have to focus on a number. In practical, everybody knows that everybody does tests differently. You guys are stressed, so that 10 degree, 20 degree does not matter. Yeah, go ahead.
Even think of it from an examining point of view. These are actors, but some of them might not even be physios and stuff like that. If I asked you to get to 85 degrees, how often do you think you could do that? If I asked you to get to 85 degrees and you could do it reliably, as an examiner, do I have time to go and double check to make sure that the patient was correct to give you this? No. There's no time.
Yeah.
So as long as it's not outlandish, you're fine.
Yeah. In every batch, we have this argument. I see among students, they're arguing, no, the book says 30 degrees. No, the book says 35. This says 40. Doesn't matter, no. All it matters is, how have you done the test? Was your fulcrum at the right position? Did you support the patient? 5 degrees up and down does not matter. So don't focus on things that don't matter. You know, where is your right hand? Where's your left hand? Where's the direction of force? What will be the normal response? That's the importance in a special test, right? What angle? What 30-degree knee flexion? Yeah. If you're not too wild, it does not matter. Right? Okay.
Describing what you would do instead of doing it. So we've talked about this before, but this is kind of taking it from the other side, that even though verbalization is very important, you still have to do it. If you say that you're doing something on the left side and they've noticed that you're on the right side, just because you said you're doing it on the right side, and they're still going to know you're doing it on the wrong side. And I think this is probably stems from an overcorrection of people thinking that verbalization is all you have to do. But no, it's still a practical exam. You still have to go through the motions and make sure that you're doing them right.
So you will be marked at what you do. So verbalization, very important. But this is also a skill station, like a skill exam. So if you're saying, I'm doing a Cosen's test on tennis elbow, and you repeat the test, but you don't know how to flex the elbow, where to put the resistance, right? Then you're not going to get marks. Right? So again, that's why you need the skill too. You need to know how to do the test. Or make the patient roll, and you have described the whole rolling procedure and everything. But if you don't make the patient roll, it doesn't matter. Right? So there's always a skill aspect that you have to do it. Right?
4, using medical terminology or physiotherapy jargon when you talk to the standardized client. We've touched on this as well. My approach to the exam was a healthy blend of both, so that I was proving to the examiner that I knew what I was talking about, but I never left anything in doubt of whether the patient would understand, because I would say something and then I'd quickly go with what that is in layman's term, and I'd always follow up with, if something doesn't make sense, if you have any questions, please stop me and ask. But yeah. Speaking too fast, standardized client and the examiner have to be able to understand you. This is one that is honestly super hard to do well. And the only way you can get better at it is by memorizing what you're going to say so that it comes out and you have this natural flow with it. Practicing with a timer so that you know how to time things. But when you're nervous, you will talk fast. When I was practicing, some of my study friends there, they would tell me that if I had a question that I was very comfortable with, I was smooth, I was slow, it was all practice. If I had a question that I was uncomfortable with, even if I ended up doing the right thing, I was speaking really fast, I was really rushed, I wasn't confident and everything like that, I still ended up doing most of it right, but they said it was like a completely different person was doing the exam. And you will get stressed, you will get something that makes you uncomfortable, and you need to be able to even just stop for a second, breathe, get control of yourself, so that, again, you're natural and you're confident.
So I can guarantee you, if you practice right, I can give you this in writing right now. If you practice right, you will not fail this exam. Right? So if you practice seriously, you have a good group, and you practice as you're exactly doing the exam, there is no way in the world that you can fail the exam. So it all comes down how you're going to do your practice from today till that last day. So that's all on you. So if you're practicing, right, even if you are Canadian grad or doesn't matter, like if you have not practiced 1,000 stations, it's going to be very difficult. But if you've practiced a lot of stations, even if there's a curveball in that exam, you're just going to easily, you know what to do. So it all comes down to practice. There's no shortcuts, but you have to have a group, right? And you have to practice very seriously, and there won't be a problem.
As for this question, the two things that I would do on exam day that would probably help you the most, number one is setting your mind right before you get in there, taking that time to not scribble down things, but understand what you're going to do and get ready with it. The second thing, which is something I learned from taking this course, which helped me multiple times on the exam, was there is no points off for stopping and asking to reread the question. So even if you know what the question is, but you need a second to calm down, there is nothing wrong with saying, I'm just going to take a moment to reread your file, to reread your question, and you can pick up that card, and whether you're actually rereading it or if you're just staring there and you just need to, there's nothing wrong with that. And I used that many times when I was either completely done my station and had extra time. I said, before we close it today, I'm just going to reread things one more time. Oh, yeah, I didn't mention that. Okay, went back into it. Or if I was really flustered and I was really nervous, there was times I stopped in the middle and I said, I'm just going to reread things one more time, made sure they're in a safe position, took a moment to collect myself, went back at it.
Excuse me. I guess there was a point left out from the first page. The first page before this. The last one, treat the clients as real patients.
Yeah.
Did you cover that? I'm sorry.
Yeah, so this one's talking to the examiner instead of the patient, and so a lot of times, you'll get nervous, and when you get in there, well, who's giving you the marks? The examiner. So I want them to know what I'm doing. So you end up doing your stuff here, but you're talking to the examiner, and basically that's bad communication with your patient. The examiner is essentially a fly on the wall. They're not in there, and if you're looking at them, that's like looking at a blank wall while you're talking to a patient. It doesn't look good. Patient doesn't like it, the examiner will pick up on it. So unless it's specifically asking you to talk to the examiner, you're communicating with the patient.
There's a live patient. So when you get your scorecard, when you're reviewing, there's a standard. Treating the client with respect and dignity. So you always think, I was not rude. I didn't do anything. So what is treating the client with respect and dignity is you actually care and you actually know that this is a real patient. So that's how you interact. Right? So that's a big point in the exam, that was the patient treated with dignity and respect. So.
Is that true that the examiner would ask the patient how your hand pressure was and everything?
I'm not sure about it, but I don't think there is time. I'm telling you, when I was taking the exam some years ago, it's a continuous thing, and there's 1 minute to read the question. So in 1 minute, I have to mark and I have to submit my sheet. So I don't have the time to. So again, the amount of pressure, that's an advanced skill. So that's an advanced skill that you can learn in courses. This is about how your right hand was, where your left hand was, which direction were you applying the force, right? And what is positive, a laxity or pain, right? If you're doing a special test. So it's not about the amount of pressure or if you were at C2 or C4, right? No, it's about if you do know how to do a basic test.
And correct me if I'm wrong, but not all the patients are physios.
No.
And would not be qualified to really comment on a lot of that stuff.
Yeah.
And even if there were, like Preet said, there's not a lot of time. There's a couple questions where you might need to either you get them obviously into a different position, or maybe you've put like a tensor band on them. They have 1 minute to get back to that starting position. If they spend that commenting on there, they've lost all that time.
Yeah.
Okay. Disorganization, jumping from topic to topic. This one is really hard to curb, because when this will happen is two scenarios. One, when you're stressed, which is how you fix that, practice. Practice, practice, practice. Two, if you don't practice and you go in there and you have no idea what the rhythm should be. I think they probably, if it comes down to an assessment and stuff like that, they're relatively lax probably on the order of things, but there should be an order that you have. And the order that we take you through here is an order that very much makes sense. And you know that when you get in there, you're doing this, then this, then this, then this, then this, and you're running through that. And it's almost probably more of a thing where you just look bad. You just don't look confident if you're jumping from, oh, we're gonna do the range of motion, and you finish one side, and then you go into isometric and you do one side, and you go, oh no, wait, let's do the other side for range of motion. They can tell that it doesn't look confident. It doesn't look like you know exactly, like you have a handle on things. But if you go through things just like boom, 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 one after another, and that's what you'll get here is that list of things to do, and you'll get good at just going from that to that to that to that to that. It looks like you've practiced. It looks like you're confident. It looks like you know what you're doing.
So it will depend on if you have your formats ready, right? So before, like 2 months into this, you should have your format for ankle, you should have your format for knee, hip, lumbar spine, every joint, history assessment. So that's a format that is standard. There's no change in it. So it's so easy to, do these stations. If you do not have your history format on your tips, you're going to be disorganized. Right? So you need to have a format, right? And then you need to write it down, and you just need to cram those. So every assessment, every history taking, every topic, there should be a format, and then you need to just memorize that format. And all you have to do is go in the station and vomit that. That's it. Just remember, I tell all my students, you will not have time to think there because of the stress level that you're in, and because of the whole environment. When you go into the station, you won't be able to think. So you will only be able to say stuff or do stuff that you've practiced. Why do people say, that I froze, I missed this, and I just couldn't do so much? Because you haven't practiced those things. So when you go into a station, if you have practiced the assessment, complete assessment, you will do the assessment. If you haven't practiced, you won't be able to do it. So again, in the end, it comes to your practice. If you're practicing each and every scenario, you're good.
Yeah, there are definitely questions that at some point or another during studying here or with the practice questions or whatever, it was pretty much the exact same thing on the exam, and I just had a big smile on my face because I went in there and boom, 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 done. I'm out of there and I'm feeling great. Confidence score is even higher. But even on the ones where I didn't, and ones where it's like you don't know what you're going to do until you see how the person acts and everything like that. If you've practiced, you still know what you need to do. It's just adapting on the spot to what you see. And so when you're a patient during practice, I would recommend that you think of some pathology. Think of something that you have wrong, because when you do this with somebody, they're going to have something that's wrong. So I have nothing wrong with my elbow. So if somebody is doing an exam on me, they can do everything like that. You need to practice, really painful when you do like that. You need to have fun with it in the sense of be an actor, pick something, play it out so that the person finds something, because on the exam, they're not going to be healthy. They're going to have something specifically wrong with them, and you need to be able to identify that. So get good at identifying here.
Excuse me, are we supposed to come up with our own formats individually, or will you give us some type
So
of
for the objective assessment, we do go over that a lot, and it's really easy. You gotta go with your consent, with your you can do a quick recap for some subjective if there's something that's really safety important. So like if they had an ankle sprain, a lot of times I would ask, were you able to walk on it afterwards? And then that gives me an idea of whether at the end of the question, if they're going to ask me, do you think they need to get an x-ray or not? Even just from that one question, I know what my answer is despite everything else. But then you go into your observation, which really comes into play for your verbalization, because if you're just, they have no idea. They have no idea what you're saying. So observation, passive range, active range, resisted isometrics, palpation, special tests. That's basically kind of the gist of it. We go into it more. For the subjective part, if you ask us, we can give you different forms that people use, different kind of mnemonics to help you remember things. In the end, I took what worked for me. I took a little bit of what I learned here. I took a lot of what I'd just done from school because that's what I was most comfortable with. And I had it written down. I was doing, age, occupation, present pain, old cars. We'll get into all of that, but it followed a format. Now, when you're doing your actual exam and you're talking to somebody, same like in real life, it rarely goes 1 to 10 in a row. You'll say something, they'll bring something up that has to deal with number 8. Okay, so then I'm talking about this for a little bit, but I'm making sure that I'm going back to those points. And so that's where one thing might be useful for when you're writing down is write down what your list is, and when you get into the exam, you have that for any time you have a subjective thing. You don't even need to fill it out. You just have it. What I would do sometimes was while practicing it, I'd have that out, and I would just check mark beside if I'd asked the question. So I didn't write down anything. I'm not actually having to chart this patient, but I have that list. Anytime I was stuck, I'd look back. I still haven't asked that. Boom, there we go.
So I just want you guys to stand up, stretch, and then sit down. I know it's been sitting for a long time. We're kind of used to it, but
You can stretch while you grab your water.
Oh, yeah. This kind of brings up something to mind of exam stamina and how Harpreet touched on it earlier. You need to work on your stamina, and when you're practicing, one of the best ways to do it is when you want to leave and you want to go home, to make yourself do that extra question. Because on that exam, you're going to be super stressed, you're going to be worried about some of the ones you didn't do even though you're trying to put out of your mind, and you're going to be there for a long time. Same thing when I was doing my written exam. I got a bunch of practice exams on the computer, and I got good at sitting in front of that computer for 3 to 4 hours and just sitting there clicking questions. You need to have that stamina for this exam too. And hopefully you've built on it before we kind of get to that final mock exam. But when we did our final mock exam in this course, at the end of it, I knew I had 10 more questions in me. So I knew that stamina-wise, I was fine because I was doing my Saturday practices after I was working. So I'd worked a whole day of physio, and then I did 2 or 3 hours of exam questions. I was exhausted. I wanted nothing more to go home. But that's where you do that. And if you stay professional, you say everything that you need to say, it becomes ingrained in you, and it's so much better. So work on your stamina.
This question I had.
guys
from
can
the
have a seat.
Previous thing that you mentioned. You go in an order, right? Let's say we have a question that assess particular joint. You touched a little bit on subjective with the patient, like with the model there.
Yeah.
And then you are doing observation, and you saw the patient, but you verbalize that, or you see some redness, or you see something like a swelling,
Yeah.
or something like a bruises, okay? But you forgot to mention one thing out of what you had in your list, okay? And now you are doing a passive range of motion or a test. Now you realize that, hey, I forgot to mention this, but luckily he doesn't have it.
Yeah.
At that point of time, how would you represent yourself?
I would just say it. So there's a story I've been told about somebody who was in the exam, and I think it was like a safety belt or something like that, and there wasn't actually a safety belt in the room, but they had gone through the entire thing and on their way out said, oh, I didn't say it, but if there's a safety belt, I would have used it. And that was enough to have covered them. And I think they got that in their feedback or something like that. So they'd still mention it. They know that you're stressed, but that way you've proven to them that you've known. They probably knew you forgot, but at least this way they knew that you knew. Again, try not to leave anything for doubt. So when it comes to observation, a lot of times you just report what you see. Don't report what you would expect to see. So if somebody has an ankle sprain and I don't see swelling, but I'm like, oh, if they had an ankle sprain, there'd be swelling. I didn't see it. I'm just commenting on what I see. When I was in the exam and there was parts for that, they actually used like makeup to make the area red so that you could comment on it. So even when you're here and you're talking with other people, I would comment on if I see a scar. I would comment if I saw a tattoo. Something to let the examiner know that I'm not just, oh, well, he's got a depressed shoulder and he's got rotation. No, I've actually looked at what he's got and I'm commenting on what there's actually there. Yeah.
We just have a question from Yogesh. Are there any sections where the examiner will cross-check what an examinee is doing?
I think the examiners are told that they can say, please reread the question, and they can say that once, and that's pretty much all the feedback that they can get from you, aside from when they have to ask a question. So if you hear please reread the question. There's a reason they've told you to do that. Stop. I'm just going to read your file for a minute. Oh, I've been doing this on the right side. I should have been doing this on the left side. There's a reason why. They're only allowed to say it once. If they say, please reread the question, you go back, you read it, and you continue, and they're still seeing that you're doing the wrong thing, they've helped you as much as they can.
Are we still okay with that, or does that make negative markings?
So there's no negative marking.
Okay.
There's no as negative marking, but you won't get marks. Yeah, but as a cross check, I think cross check with whom, right? So they don't cross check with the patient, because that's not a reliable source. They do cross check with the list that they have, and that list will have the proper procedure and everything that they mentioned, and they already have knowledge of what the test is. For example, if you're doing a test, so they don't cross check with the patient, but they do cross check with the lists, the marking lists and stuff.
Did we get through all the others?
Yeah.
Oh wait, yeah. Trying to do too much in a station we kind of talked about already. Of you're just doing what's asked and not more. Letting the performance in one station affect the performance in the next station. We've talked about this a lot as well. I had stations where, like I said, I went in with a smile. I knew that I'd done everything right, came out and I felt great. I had stations where I came out and I thought immediately like, ooh, should have done that. Ooh, yeah, should have done that. Ooh, kind of missed that too. But even in those ones, like you just, I don't know. For me, it was almost like you're just numb at that point, and it was just like, okay, moving on to the next one. Get to a written part. Know the first question. Know the second question. Third question is something that I looked at my study things, but there's no way that they're going to put that on the exam. Boom, list 5 of those. And again, make up something as good as possible and keep moving on. There's no time to let one performance affect your other one, because you know that it's inevitable, that you're going to be stressed, that something's going to happen. Again, correct that with practice. Get out of your comfort zone. Really bomb a question. Have your partner tear into you about what you did wrong, and the next question, go out there and perform like nothing ever happened, and you just got the good stuff out of it.
See, another thing about stamina is so important, because half of you I can see, your faces like, oh, when would they stop just talking? Let us just take break. So that's why stamina in this exam is very, very important. Because if your exam starts at 9, you will be in that center at 7 or 8.
When I was in the late one, like I said, I was so nervous. I didn't sleep, so I'd been up since 6 o'clock in the morning, and I don't think I started my exam until probably 2 or 3 in the afternoon, and I wasn't done until 6, 7 at night. So I'd already been up for 12 hours, and for a lot of that, I was in that super stress mode. I was in the exam mode, and you have to be able to kill that last station like you did your first station.
Yeah. So Subin asks, is there any real patients in any of these stations? So these are not real patients, because you're not a PT, so they can't put a real patient, but these are standardized patients. So these patients have been called in previously a day before, told them what to do, how to act. So they are actors. They're not real patients. You can't be performing on real patients.
Even if they wanted to,
Yeah.
they had somebody who has neck pain, they're not going to have that person with neck pain go through range of motions through the whole day. That would just aggravate them. That's not ethical.
Yeah. So they can't have real patients. So the next presentation is about how, when you go home right now, when you form your group, how are you going to practice, and how you should do in the station, right? And so the first point is start each station by scanning the room. Why is it important? For example, the question is, teach 2 strengthening exercises for a patient who have ankle sprain, right? So Katrina, tell me one strengthening exercise for ankle sprain.
Dorsiflexion.
With
Resisted dorsiflexion.
Yeah, with what equipment? What's your favorite equipment for strengthening?
I could have them do it with a resisted band,
Yeah.
tied up
That's
against
good.
a pole.
Resisted band. What's your equipment?
You can get them doing heel raises, toe
Yeah.
raises,
Yeah.
either seated or standing.
What else?
Maybe a small sandbag.
A towel,
Yep.
right? So there are 10 different ways of doing resisted exercises, right? But there are 2 equipments that are kept in the room, and they want you to use those two equipments only. So if there's a TheraBand there and you have not scanned and you have done toe raises or towel, but there's a TheraBand there, and there's a reason why their band is kept, because indirectly they're telling you you need to do 2 exercises with the TheraBand. So that is why it's very important when you enter in, forget the patient, forget the examiner. You enter in, take a deep breath. Before starting, before even looking at the examiner, scan the room. See what all is there, make a mental note, then start your station. Right?
Yeah, or if you see that there's a goniometer there, chances are they want you to use it. There was also times when they might have like a specific list of exercises that you're supposed to go through, and you need to make sure that you're doing those exercises. On my exam, I'm not sure if it was a mistake or something like that, but apparently when prompted correctly, the examiner would give you a calculator, and that was for something that you had to do with your subjective. I didn't see a calculator, never brought it up. Somebody else I was talking to said that they brought up a calculator and they were given a calculator. Whether that was wasn't out there for me when it should have been, but you need to watch the room and see there. And not only just for what's in the room, but where is the position of the patient? Is there anything in the way? If you know you have to walk them, is there something you have to get out of the way? If the bed breaks are on, which is a really important safety thing that can easily be forgotten again when you're doing your practice, always check the brakes, even if you're on one of these wooden beds. I'm verbalizing that I'm checking the brakes.
So again, locate where the instruction sheet is, because of the stress, you will need to read the question. Our examiner might say read the question. So before entering the stations, you need to scan the room for equipment, look at the patients, their appearance, their attitude of the limb, where those instruction sheets are, and then proceed, right?
They wouldn't place something like an item deliberately to mislead us.
I don't think so.
No.
And I mean, even if you saw that there's TheraBand and maybe you just don't feel comfortable with TheraBands, you'd still get points for doing other exercises, but they might give you more for doing what they wanted there.
Yeah.
And some people have asked me, like, what exercises can you do? It's hard to think of them. It's really not. If you think about even the ankle, there's 4 directions. You can do those exercises isometrically. You can do them concentrically. You could even do them eccentrically. That's 12 exercises that you could start with that are applicable to any ankle injury. Obviously, it depends on how they present and stuff like that. Throw in a resisted band, and you've got the exact same thing with a resisted band. There's 24 exercises that you have in your mind and stuff like that. There's so many things that you can do. And one of the things that I didn't know when I was going through here is that even just for stretching, everybody thinks a stretch is passive, right? There's such thing as active stretches. And if you're working on somebody you want to get their extension, you can even just give them active extension. That counts as a range of motion exercise built on getting their extension back. It doesn't have to all be passive. So boom, anytime you have a stretching thing, active and passive for any range, there's no way that you're not going to have enough exercises to show somebody.
Just to answer a question, what is the unemployment rate in physios in Canada who have fully passed the exams? What is the unemployment rate? Any guesses? Just throw me a number. Yeah, what's the unemployment rate? Just throw me a number. 1%. Only less than 1%. Sorry, less than. So there's less than 1% of physios that are unemployed in Alberta. So what would Alliance gain, or anybody would gain, from tricking or misleading? Right? They want us to pass. They're just waiting for us to do the right thing. So take this thought out of your mind that they're going to trick you or they're going to mislead you. No. It is very simple. Just do what they're done. Do it, with confidence. Be safe, and you won't have any problems. There's no trick questions, right? So again, number, do what is asked, right? Unless the instructions say otherwise, assume you have your consent, right? First, we'll discuss on this. It is better to do few things right other than trying to do too many things, and there are no trick stations, right? So why do we take consent? A lot of students ask me, these are standardized consent, the consent is already taken, but why do we take consent? According to me, I am taking consent in order to help me memorize what I'm going to do. The question is, teach them 2 exercises, 2 resisted exercises, 2 stretching with a TheraBand, saying, good morning, my name is Harpreet Singh, and I'm here to teach you 2 exercises with a TheraBand, in which I'm going to be doing this, and 2 active range of motion exercises. I'm going to be doing this, and do you have your consent? So what I have done is, I've already told the examiner that I know these 2 exercises, and I've told my brain, hey, we're going to do this. Right? So that's why I think repeating this consent, what is consent? Consent is what you're doing, why you're doing, explaining the precautions, explaining the benefits to the patient, and moving on. It should take you less than 20 seconds. Right? So less than 20 to 30 seconds. And then, so it reminds your brain that this is what I have to do in this station, and you go on. Right? So, very important thing. If the examiner tells you, reread the instructions, ask yourself, first, are you working on the wrong side? Second, are you doing an assessment when you should be doing a treatment, or treatment when you should be doing an assessment? Or buzzwords, have you missed 1 or 2 important words in the instruction? So here you go. Right. Do you want to talk about this a bit? But people, Thomas, people get really stressed. Students get really stressed when they say, read the question.
Yeah.
Right? Yeah.
And it's difficult because it's not a lot of direction with that. It can be something as simple as you've just done the wrong side, or something as you're doing an isometric instead of a concentric or something like that. But it also could be, you're doing assessment when you should be doing treatment and stuff like that. It doesn't necessarily mean that you're doing poorly. It just means that you're not doing what the question's asking. So again, take that moment, don't let it fluster you, and just reread the question, think to yourself one more time, what is it asking me to do, what do I have to do, and then go back and do it.
Yeah. So you will have problems in a station. If you have a problem in station, do the best, because they do not expect you to ace the exam, because the questions are like this, and they are tough questions. You will have questions that you don't know about. Just take a deep breath, do what you can, make sure you're safe, move on. There will be another question waiting for you.
Yeah, and even if you don't know what to do, there's things that you can do. So we had a mock exam here, and there was a pediatric question, which is not my specialty. And I read it, and I said, I have no idea what I'm going to do. It was give advice in education and teach 2 exercises. Went in there, said what I did know about the subject, gave 2 exercises of what I thought was fine. When I got the feedback back from my examiner, it was aces. I didn't know anything about it, but I didn't say anything that was unsafe. I gave brief education on what I did know, and the exercises that I did were somewhat relevant. I'm sure I didn't pass, if it was an actual thing, I wouldn't have done 100%, but it was enough to pass and everything like that. I've even heard stories of somebody who went into an exam, read the question, didn't know anything, so they went in, got their consent, said, this is what I'm here to do today, this is what I know about it, that's about it, and that'll be it for today. Next time I'll do it. So they didn't even risk doing a failure or anything like that. They kept it safe, but even that, I feel like there's something you can do. If you take that person through breathing exercises, some relaxation techniques, that's applicable to anybody. That works.
Mm-hmm.
Yeah.
Sorry, what about the things that, the last time there was a mock exam here, I was a volunteer, and there was one discussion, can I say the topic though?
Yeah, go ahead.
Was about tick infection, right?
Yes.
Lyme's disease.
Lyme disease,
Yeah.
Exactly. So I absolutely didn't know anything about it. What should we do in that case?
So when I had that question, same thing. I read it and I said, "Nah, you gotta be kidding me." And I went in there and what the question was explaining it to a student. So you have to be respectful to them. So, hi, my name is, I'm here to talk about this with you. What do you know about Lyme's disease? What piqued your interest in this? Oh, well, I have a patient who had this, blah, blah, blah. Okay, so what did I know about Lyme's disease? Ticks, okay? So, what's my advice in education? I know that it comes from ticks, and that it's not very well researched right now, and there's some funding problems in in Canada for whether you can get treatment for it or not. I couldn't remember any of the symptoms or anything like that, so I didn't talk about that. I went into prevention. Okay, well, it's ticks. Where do you get ticks in the wild? Okay, so you want to be aware of what the ticks look like, what to avoid, to make sure you clean and everything like that. Again, this isn't anything that I've studied. This is just somewhat applicable advice. I said to the student, after this we can go and get some more resources on this. We can talk about this at a later time. I really appreciate your interest. I think this is good to learn about. Maybe we can do an in-service on it. Yeah. Nothing I said was not safe. There was some brief stuff that was kind of applicable. Even it was Ramesh who was the examiner, and he's not known for pulling any punches on. He said, you still would have barely passed that station. And the amount of information that I gave was like that. But I was professional. I didn't try and lie my way out of anything. I gave what I could, admitted what I didn't know, and just did everything very professionally and got like that.
This was one of the questions in our mock exam in our course, so Lyme's disease. So because it's been gaining popularity in the sense a lot of people in Canada is talking about it, so we wanted to put this question as in our exam. So yeah.
I have another question.
Yeah.
Yeah, with your case with pediatrics, is it better to just say something, or is it like it's not worth risking it and saying something that isn't like a major risk?
So for me,
when you're working with like a kid.
Yeah. So for me, like I said, not my strong suit. And when I got here, I got a lot out of the session here. I can't. Who is it? Sarah that teaches the pediatric one. Megan. She's fantastic. It's a really good session. But what I took out of that was pediatrics isn't going to be a huge component of the exam. I could kill myself trying to do that, or I could get the basics and then be able to handle a question like that. So I got buzzwords for the subjective history. So asking like the mom about the birth and about like developmental things and everything like that. I've never been good with knowing the developmental stages. I've probably had to learn it 3 or 4 times in my physio career for exams and forgotten it as soon as I did because it just never really stuck. So I would try and remember 3 or 4 important ones that you can ask about. So anytime a subjective came, I was asking questions about pregnancy, development, stuff like that. Boom, that's great. When it comes to the treatment exercise and stuff like that, half the time it's just doing something that's fun for the kid and kind of gets some kind of thing for it. So I had a general idea of what I would do if I came to that question. Enough that I would pass. So it's not like I completely forgot about it. And there was stuff that I thought I could try and stuff like that on the exam. But if there's something that you really don't know and it's not a very big component of the exam, make sure that you just know enough. You just got to know enough.
Okay. So the written station is worth 50% of your mark for that station, right? So spellings do not count. Make sure you write clearly. So just focus on the last line, please. A good written station answer can save a poor performance in the clinical part of the station. So you have 8 5-minute stations. If your theory is strong, you've almost passed 50% of the exam, right? So and even if you do not do well, if you like feel rushed on that 5-minute station, if you have given a good answer and it's correct, you will pass. If you have not given a good answer but you have performed well in the practical, you will not pass.
And I don't know if you guys have had exams before where you just write down everything you can think of. This is not the case. If they ask you for 3 things and you list 10 things, they look at number 1, number 2, number 3, and they don't even read 7 to 10. So your best answers should be 1, 2, and 3. Because they won't look at if that one's wrong, but these ones are right. They don't care. 1, 2, 3, no more, no less than they ask. And unfortunately, a lot of times they will ask for a lot of points. But there's things that you can write down a lot of times that work for anything. Like, again, relaxation techniques, breathing techniques. You can justify that for any patient anywhere. So there's always things that you can kind of write.
The main thing is when they ask you to write like 6 or 8
Yes.
items, it's like you can memorize 4 or 5.
Yep.
at least.
And then you just have to really scrape the bottom of the barrel, think outside the box, and try think out something like that. I mean, I didn't always get all the points that they asked for because I couldn't think of any. Yeah.
This is just a curious question. If you're asked about a focus history station and you're just checking just to be safe on a safe side, like something wrong with the vision or hearing or swallowing or speech or bowel and bladder movement or something which could be actually life-threatening,
Yeah.
which is hidden, right?
Yeah.
And the model says yes. What would you do? Like, it's a 10-minute question
Okay.
that you cannot quit at second or third minute that, oh, he said yes, I have to make a full stop here and go and see your doctor.
Yeah.
Or call 911 and take him into the hospital.
Yeah.
In that situation, what would you do?
So, for starters, if it's focus history, that's probably 5-minute one. There will be ones where it's 10-minute and it's basically a complete history. If you were talking to somebody and they have back pain, you say, "Oh, do you have any pins and needles?" "Yeah, into my feet." "Both feet?" "Yeah." "Numbness?" "Yeah." "Okay, well, immediately that kind of bilateral pins and needles, that's a red flag that warrants further discussion. I don't need to stop right there. I can still complete my subjective history, and the important part is, at the end of it, I've gone, some of your subjective reports are a bit concerning to me. I think it would be important for you to go to urgent care to see your doctor and get these resolved. What I will be doing is writing up my findings, giving you a little piece of paper that you can take to your doctor and give to them. So you still know the whole story, but you've still dealt with it appropriately. You've recognized that's outside of your scope of practice, and you know where to refer appropriately. And I always like the term urgent care, because to me, like, urgent care at your earliest convenience means that if they can get an appointment with their family doctor that day, great. If they need to go to emergency, great. That's still urgent care. Yeah. Same thing with exercises. I would always tell somebody, I'm going to print these off for you. It'll have pictures, descriptions, everything you could want, and I'll give that to you before you hand out. There's no printer there, but I would just say it. Yeah.
So communication is important, right? When you're communicating in a station, make sure you use everyday language in the station, especially when you're talking to the patient. If you tend to speak quickly, slow down, pause. If you're not speaking loudly, just try to understand and practice. But make sure you ask the patient when you're communicating, or especially teach exercises, or say, "Do you understand? Do you get it?" Or any kind of verb that you can use to make sure the patient is understanding. If the patient would not, yes, go ahead. So it's not just about coming in and just speaking whatever. You have to make sure that the patient understands, and just ask that feedback from the patient, especially in those stations where it's about educating the patient or talking or teaching them exercises. Do you understand? Right?
And I'd also say that when you're checking with the patient, they understand everything like that. I would do it frequently throughout the exercise. So we're going to do this exercise. Does that sound all right with you? Okay, good. While you're doing it, you're checking in. Does this hurt? Does this feel okay? Do you feel like it's working this kind of area and stuff like that? Just like you would with somebody else. But when I was doing a lot of practice exams, a lot of times one of the marking criteria was, did you check with the patient's comfort while they were doing the intervention that you were employing?
We've got another question. Do they see numbers like 4 treatments for 3 treatments, they asked? So I think, Memu, the answer is the top 3. If you top 3 options, if you're writing, they'll look at the top 3 and then they will ignore the rest. I hope I answered the question. I'm just confused about what you're asking. So communication, if the instruction says describe to the examiner or tell to the examiner, please verbalize this loudly to the examiner in order to get marks. Otherwise you won't.
Actually, can I jump on that question for a second? There was one question in my exam. Again, I can't say what it was, but I knew it was one of the ones I did not do as well on. And it was because I had really hadn't thought things through where, we talked before about how ankle, there's 4 movements. You can do those concentric, eccentric, you can do them isometric. There's so many there. I think a lot of times in school, sometimes you can group things together. And so the question that I had was asking me for 3 different exercises, and I could only think of 2. And pretty much as soon as I got out of there, I had realized that the intervention that I'd put in was actually kind of a combination of 3 or 4, just by doing the one. And if I just broken it into piece by piece, I had enough exercises and everything like that. But as it stood, I was just so used to everyday life where I combined 3 or 4 of them together, because you get 3 things at once, that I did those 2, and I could not think of a third and got really flustered and everything like that, when really I had shown the examiner I could do 5. I didn't verbalize it. I doubt I got the marks for it, but yeah.
Mm-hmm. Explain what you're doing and why. So explaining helps you stay focused and helps the standardized client understand what you're doing and what you want. Explaining helps the examiner understands what you're doing. Same thing, when you're observing a gait or a posture, just verbalize it what you're doing, right? So again, treat the standardized client like a real patient. Again, I think I really like this. This is really important. So you read the question, plan what you're doing before. So this is before. You read the question in a minute. You plan what you're going to do. You write down in that notebook that you have given. Scan the station, demonstrate, talk, start again. Right?
Could you please explain this?
Yeah. Go ahead. I'll answer your question. Go ahead.
Sorry. Anyone who has experience with this, would you recommend reading the questions first or the scenario first? Is there such a thing as like reading the questions first? And it helps with planning and everything. Do we have?
For the 5-minute ones, it's usually not too much. It's maybe a couple sentences, and then there's the questions. For me, I read through just top to bottom, and then I kind of knew. Just because a lot of times, even if you read the question or what they're asking you, you don't know the context of what it is. So show somebody ankle exercises. Well, I don't know if they had a stroke or anything like that. Like reading that wouldn't help me, but having that context first. Oh, it was an ankle sprain. It wasn't a stroke or something like that. Now I know what I need to do. Yeah.
Again, the question from Subin is whether we have to give the dosage of exercises precisely.
Yes and no. So yes, in the sense that you need to tell the patient how many to do and how often to do, just like you would in a real clinic. It kind of comes down to the range of motion again. As long as it's not outlandish, it's probably fine. So if I told somebody, and honestly, 3 sets of 10. 3 sets of 10, every physio knows, pretty much works for anything. 3 sets of 10 of this. If you said, I want you to do, 1,000 5 times a day, okay, well that doesn't make sense. That'd be terrible. So that wouldn't work, but they're just looking for you to make sure that the patient knows how many to do at home. Because just like in real life, if you just showed the exercise, well, they might go home and they might do it once a week, or they might go home and they might do it once an hour. You need to be specific with things. So in that sense, yes. For the actual numbers, probably not. So for me, anytime it was strength related, 3 sets of 10. Anytime it was stretching related, 3 30-second holds. For stretching, once a day. For exercising with strengthening, 3 times a week. That was it. Kept it pretty simple like that.
Perfect.
Here's
So-
a safety question. Same question. When you say 3 set of 10, it's very easy to do it for a normal person.
Yes.
But think about it. If a patient's coming from a post-fracture, it's very difficult to do 10 times because pain comes, right? And we are actually demonstrating only 2 or 3 repetitions because we have a lot of movements to do, right? So if you say 3 set of 10, the one you have demonstrated only twice or 3 times, you don't know it's going to be fatigable or it's going to make him pain, or are you safe there?
So a couple things that I said in the exam that I say in my everyday practice is that, one, this exercise is not designed to cause you pain. It's not supposed to be aggravating your symptoms. So I want you to do them within your tolerance. So immediately I've told them that if they're going and it hurts, they're not going to do that. So boom, safety's okay. I tell them if you do feel like it is aggravating you, then you can do less. If it's still aggravating you, then you can just stop. So I've told them not to really push through and aggravate things. In the rare case where maybe you have like a total knee or something like that, that's one of the ones where maybe no pain, no gain is important, and you need to tell them that they can go into pain. It's safe when they're on the operating table. Somebody takes their knee and goes like that, they're not going to break it, so it's really just pain limited for that. One of the things that our people talk about later and everything like that is hurt versus harm, and that's another very important advice and education thing that you should have down. I think probably a lot of questions it would come into play with is going to be something like whiplash or something, or even, a fracture. And they might say, well, you told me not to move my hand if it hurts, and it hurts whenever I even look at my hand. And that's where you need to be able to explain that it is going to hurt while you do some of these exercises. It's going to be uncomfortable, but it's not going to be harming the structures there. So it really hurts. It hurts your neck to move. Well, I don't need you to go crazy with it. We just do a little bit, and that movement's going to make you feel better. If you just did bed rest and you didn't move, that would have a negative effect. So really important to have a good spiel about advice and education for hurt versus harm.
Just to explain this, so this is a nutshell in what you're going to do in the exam. I'm just repeating this. So make sure you're reading the question very carefully, and you have a notebook, and you're writing down even before going in what you're going to do in that notebook. Writing down is another feedback you're giving to your brain. This is what we're going to do, so that when you come out of the station, it's like, oh man, I missed this. Why did I miss this? Because you didn't give feedback to your brain earlier. Because of the situation, you need to read the question, write it down in your notebook, what you're going to do, right? And then that's planning. So plan, I'm going to do this quickly. Enter the station, don't look at anybody. First, scan the station. Look at what equipment. Plan immediately, this is equipment I'm going to use. Look at the patient, what's the position? Is the position telling me something? Start, right? And then you perform, verbalize, communicate properly, get out. Don't think about that station. Start the new station again. Right?
Question for you, Tom. Just what was your demeanor like when you walked into the room, and just off the back of what you said? Do you acknowledge the examiner other than handing him the ticket?
So, I'm terrible in awkward silences, and I like to lighten the mood with smiles, laughter, anything. So when I came into the room, I would be handing over, there's the little stickers that you got to give, so I'd be handing over the sticker to the examiner. I'd put my thing down, I'd wash my hands, and then I'd go in, and I'd big smile on my face, like, hey, my name's Tom, I'm here to blah, 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 and go through that. And even when I had time after, and I was just waiting for the buzz to go, I was still like chatting with them and stuff like that, like, oh, like, long day for you guys. And a couple times I got laughs, a couple times I got bad stares, but like that's just that's just how I am. And I think there was two stations that come to mind. One was a 10-minute subjective. It was like slightly subjective, and then you had to give advice and education. And I got along so well with this lady that we were both laughing and joking. I forgot that I was actually in an exam for a moment, and that it did feel like a real patient and everything like that. Like I was making jokes about her husband and stuff like that. Like it seemed very natural. I tried to make it as natural as possible because I feel like that would have reflected well for my examining. Another one, and this is one that we practice a lot here, is if a patient is supposed to be difficult. So say it's like a teenager who's on their phone and they don't really care, or if it's like somebody who's hard of hearing, or somebody who's really angry at you from the last treatment and stuff like that. It didn't matter to me how angry this person was, how not interested in the session they were. Big smile, super enthusiastic, so positive about everything, like did not even give it a chance to take hold on what I was doing and everything like that. So afterwards, come out, be sweating, be worried about it. But in there, I was the happiest physio in the world.
Sorry, going back to that question about the exercise dosage,
Mhm.
do they have any specific guideline in mind when it comes to cardio endurance exercises?
So when it comes to endurance exercises, if you're talking about like a desired heart rate range, which you can, then I think, and Harper, you may correct me if I'm wrong here, but you'd still go by the very generalized standard of 220 minus their age and then 60 to 90% of that. And so you can verbalize that. Another one that we mention here is like for cardiac patients, and they should be able to walk and talk at the same time. So if they're walking and they're exercising and it's too much, they can't talk, then it's probably a bit too vigorous for them. If they're walking and they're able to sing, that's probably not vigorous enough for them. Another thing that you can mention is your rating of perceived exertion, and whether you're using like a Borg scale from 6 to 20 or something like that. I think you can talk about how for those cardio things, like you want to start off at about like a 12 or a 14 or something like that. I think we go into that a bit later, but those are some kind of things that you can use. Again, if it was like you're giving out like a jogging program or something like that, just like in real practice, it's all about a gradual return. So I'd say try 5 minutes. If 5 minutes feels like it's okay, then maybe next time you can slowly go up. And I remember from my kinesiology days that whenever you're changing something in your training, it's one thing that you're changing and by 10%. So you can go off that. So whether you're changing the amount of weight that you're doing, you're changing it by 10%. If it's the time that you're doing it, by 10%. Of the intensity, 10%. And making sure that that one variable is the only thing that you're changing, so that if something happens, you can attribute it back to that one variable.
Okay, so yeah, but
Would the client will always be cooperative when
Loud,
you are is the client always cooperative when you are dealing with him? For example, if you have planned an exercise for a patient, just for example, if he's having osteoarthritis and you are flexing or abducting or whatever you are doing, and he says, "Oh, I have pain in this," so how do you deal with that?
so the first part of the question is, would a client or would a patient standardize will always be cooperative? In your practice, would you always find a patient who always listened to you and cooperated? No.
Not always.
So that's a skill. So in the exam, there could be a question where they will ask the standardized patient, be rude or be angry or be something that that you don't understand, or being uncooperative. It's how you handle that situation. You have to talk. You have to explain hurt versus harm. So sometimes there's an underlying thing that they want to talk about. Why is this client not cooperating with me? Or so you need to understand this. Once you understand that, then he's going to do whatever you're going to say. Maybe he's fearful. Maybe he's not properly positioned. Maybe you're missing a belt. So in one of the exams that I was taking, we made the examiner, the patient, saying if the student doesn't put the belt, just don't get up from the chair. Just say, I don't want to walk. I don't want to walk. The minute the student put the belt on, he walks. So if there's something like that, then this means that you're missing something. You're missing important way, safety, support, or you've not told about hurt versus harm, or you've not told about importance, or you've not asked that.
There's always a reason why they're uncooperative.
Yeah.
That reason can be pain. That reason can be lack of comprehension. There's always something. So there's even questions in when you get to neuro and stuff like that they might just not be able to deal with the condition that they're acting out or something like that. There was one that we'd been practicing that had been passed down. I don't know. I can't remember if it was an actual exam question or not, but basically similar to what Harpreet was saying, the person who was acting was, I think it was some kind of sit to stand motion. I can't remember the context behind it. And they were told at the beginning in the thing that they were fearful about it. And they were told that no matter how good the positioning was for the sit to stand, that they were supposed to fail at it twice. to see if the person would go through and keep encouraging them to do it that third time. So when I went and I did that practice question, I got my patient all set up perfectly, got them up, and they didn't go down and they felt like that, and I stopped. I was completely stumped. And I just ended the question right there. Terrible. Person told me, no, you were supposed to ask me to do it another time, and I was going to get closer, and the third time I would have gotten up. Really important lesson from that is that you need to just keep going. Be positive, keep encouraging, and you got to trust yourself. Because I went through and I knew I did everything right. Foot placement was right, hip was right, back was right, hands was right, everything was correct. Person didn't go up. What more can I do? What I could have done was just kept encouraging. That was it.
Good. So we're going to start next week. So next week, there's a little change in format. So we're going to start with ortho straight away, right? So the first class for Edmonton group will be on Saturday, right? For Calgary group, it will be on Sunday. The location and everything is on the website. It's the LifeMark Sherwood Park location in Edmonton, and this location for Calgary. Every Sunday, same time. There's no change in time, so there's no confusion, right? So we will be discussing lower limb. This is an Ortho 1 class. So we'll be discussing ankle, knee, hip, and lumbar spine. So what we'll be discussing is how to assess ankle, assess lower limb and lumbar spine, history taking, right? And then we will be discussing different conditions and exercises. Right. The second class will be upper limb. I'm going to send you a format, but second class will be upper limb and C-spine. The third class will be ortho, will be just conditions and exercises, right? Then we will start with multi-system, will be one class, and then we will start with neuro. So I'll send it down. So for ortho, it will be me and Thomas. For neuro, it might be Megan, and for peds, it's also Megan. You can have all the instructors' profile on the website. We'll also have a special class for transfers and gait aids. So that class is taught by Sarah. So Sarah works for Alberta Health Services, and she is the team lead, or she's the leader. She's a lead trainer for Alberta Health Services in transfers and gait aids. So what it means that she teaches Alberta Health Services nurses and people in AHS how to transfer patients. So she conducts courses for Alberta Health Services in this. So we are very lucky that she agreed to take our class, and she'll be coming here and taking that class. So my expectation from you guys is that you will know how a basic assessment is, right? What basic theory is, how to take history, how to do strengthening exercises, what are strengthening exercises, how to do special tests, right? What are the special tests for each? 2 for each joint, right? Each condition, and then basic stuff. And then we'll go through an hour of presentation. We'll give you your notes, and then after an hour of presentation, we'll just start practicing. So if you've already practiced and you already know, we can go through 50-60 questions easily. But if you have not, and if we are still stuck at how to open the station, how to close the station, how to do those stuff, that will take time. And that's why every time ortho suffers. The reason ortho suffers is because we spend too much time in just these basic details, how to take consent, how to open a station, how to close the station, right? We're not focused on the skill part of it. So your job right now is to form groups. People in Edmonton, people in Calgary. You need to form groups right now, today, 3 people, and then people in Edmonton, please send me your phone numbers. We already have a WhatsApp group. And then once you form the group, you will start practicing. What will you practice? You will start practicing lower extremity. You will start practicing how to do an ankle assessment. Question, ankle sprain, do an ankle assessment. Second question, ankle sprain, do a focus history. Third question, knee injury, do a knee assessment, knee history, again same hip and lumbar spine. Next, 2 special tests for ankle, 2 special tests for knee conditions, 2 special tests for hip and lumbar spine. Third, then you need to practice range of motion exercises for each joint, 2 stretching exercises for each joint, 2 strengthening exercises for each joint.
And goniometry.
And goniometry, yes. So this is your homework till next Sunday. For Edmonton students, till next Saturday. Right? This is your homework. So you need to know, because if we start teaching, hey, this is the fulcrum for this joint, this is the movable arm, then we will not be able to cover a lot. Right? So the class goes on a flow. Just remember, anybody is teaching takes their energy from the students. Right? So like the reason I'm stopping right now, because half of you want to go home, right? You know, I can stay for hours and hours. If you are with me during the class, if you want to spend 6 hours, 7 hours, 5 hours, I will be there for you. But if I'm getting a vibe that you're tired and you're not interested, I'm going to end the class and then you guys can practice. So the vibe that you give me, I'll go on that. And again, if we are missing and you think this class is not up to the standard that you expected, please let us know then and there. Because
don't wait till after.
Yeah, because this is not a normal course that, oh, we can learn later. This is your, for some of us, this is life and death. For example, this is your career. If you do not get the information that you need, you would not pass, and then, you just can't practice, and there's it. Because this is your only attempt that you have. Assume this is my first or my last attempt. So if there's something that you think that's lacking, call us out. If there's something that we feel that you are lacking, if you do not know exercises, or if you do not know how to do a special test, or you do not know how to do a basic, we'll refine you. We'll do what the standard is, right? We'll tell you how it's done here. But if you do not know what to observe or how to do active motion, we will call you out. Be ready. When we start the class, we'll say, Ali, come in, let's perform. Or, Yuvraj, come in, let's perform. You just can't say, oh, I'm afraid, or I'm not comfortable.
If you feel that way, that means you need to be up there.
Our
if
job,
you hate being up there, you need to be up there.
Our job is to make you uncomfortable. Right? Again, this is, like courses are different, right? In other courses, because they've taken money from you, they want to be comfortable. So our job is, if you pass, then you will tell other students and we'll have a batch next year. If you don't, then there's no point in us continuing these courses for next year too. So that's why, it's in our best interest, in your set, that you pass. So again, ortho, make sure you do all this. Be ready. I'm going to choose random people. And we're going to do a class demonstration before we start. And in between, we're going to ask people to come and perform. We'll have a standard presentation for 45 minutes, an hour, and then rest 3 to 4 or 5 hours. We're just going to practice in groups, practice.
And make sure when you're practicing here, and if you can at home, different people, guys, girls, big, small, because you never know what you're going to get on the exam.
Yeah.
So if you get comfortable with just your buddy, then you're only good with just your buddy.
Yeah. So the session, there's no breaks. So there's no food break, or you bring your food, bring your water, bring whatever you want, and just eat while you're practicing. But there are no breaks.
And another thing Harpreet mentioned last time, if possible, the person you're studying with should be a physiotherapist or somebody with knowledge of this field.
Yeah.
Somebody who's not is not going to be reinforcing good habits in you, because they don't know. They might be very well intentioned. Your significant other might want nothing more than for you to pass, but they don't know physio. You gotta practice with somebody who knows physio.
As our homework till next week, at least two special tests for each joint, stretching, to strengthening, range of motion.
Yeah, and how to do an assessment.
assessment.
Objective assessment and history taking.
Okay.
At least you need to know,
Yeah.
you know,
First
what's
day
the
will be
format.
rough, but don't worry, we'll
Yeah.
get through it.
Yeah, it's going to be like observation, and it's the format is set. History taking, oh sorry, assessment is what? Observation, active, passive, resisted, palpation, special tests. That's it. But you need to know this.
Is it always on Saturday for everyone?
So for ortho, it's going to be Saturday. Rest is going to be Sunday.
I'm working out of town for my clinic
Yeah.
in Grand Prairie
Yeah.
coming Saturday, and I cannot cancel it because we booked 3 weeks in advance.
Okay.
So I will be coming home like 10:30 on Saturday night.
Okay.
Yeah, same here with me. So, I was not able to come.
Are you guys able to come here for Sunday?
This coming Saturday.
Can you come here
Like
for
I
Sunday?
will be out like at Whitehall and Grand Prairie from my clinic from like Wednesday till Saturday, like Wednesday evening till Saturday.
Yeah.
And like next day morning to come to Calgary.
Because we were thinking that you will conduct on Sunday.
Yeah.
That's
The
why.
only thing is I am teaching ortho in Edmonton, so I have to drive on Saturday, and then I have to come take a class here Sunday. It's only ortho.
Can you do it this time only for Sunday to Edmonton?
Like I could give my days in advance that I'm not going to go out of town trips, but this is a very short notice
That's only for this.
because I'm booked there.
Is the Calgary group okay with Saturdays? First 3 classes?
So I could do Saturday because I work Saturdays.
Yeah. So
I have to drive from Regina, right? So
Yeah.
I'm driving. I start driving on Saturday.
yeah.
So
Sure, I work on Saturday.